Hello, everybody. So today is our webinar, Transforming Healthcare IT from Compliance Basic to AI Innovations. And let's wait for a minute more to make sure everyone joins. We still see people joining here. By the way, please write in the chat where are you from. We mostly usually have people from USA and Canada, but sometimes we have people from other places as well. Okay. 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 I think we're good to go. Yeah. So hello everybody again. Today is our webinar about compliance basic and AI innovation in healthcare. And with me here is Andrew Lichuk, and our guest is Jason Merrick. Please say hello. Yes, thank you.
Hello.
Yeah, so to make introductions, so I am, my name is Igor Milenchuk. I am in IT since 2012. I help companies with modernization, and I help with business operations and optimizing revenue and delivery for software projects, specifically in the enterprise domain, and we used to work in the startup domain as well. Andrew, please introduce yourself.
Yeah. Hello, my name is Andrew. I'm in IT since 2004. I'm working as a CTO, fractional CTO, and a tech advisor. So my main expertise is leading the project and increasing the team from from the scratch to up to 100 people and more. Yeah.
Hi, I'm Jason Merrick, and I'm here as a guest today. And my background is largely in healthcare. I started early at the age of 18-ish as a volunteer firefighter on a fire engine, and then it progressed from there. I've worked in a lot of different settings in the healthcare. I've worked in fire departments, ambulance agencies, hospitals, clinics, outpatient ambulatory centers, nursing homes, and more. And so, as a paramedic and EMT and a nurse and various other positions as well. So, and I've worked at kind of familiar organizations such as Kaiser, St. Joe's, Sutter, Providence, and others, including Sonoma Fire, San Diego Fire, and more. So that's my background as it relates to healthcare, and I hope I have something to provide here today.
Thank you, Jason, for the introduction. And we can get to the actual webinar. So I'm excited to talk with you about something that's becoming more and more important every year for the patients, and also becomes a business opportunity. Specifically, how healthcare organizations in the United States and Canada can move from outdated, hard to maintain system to modern, compliant AI-based solutions. Before we look at what's possible, we need to understand where we are now. So let me give you the short outline of the webinar, and I will then start with the main information about the state of healthcare in Canada and US from IT angle. So first we'll speak about legacy systems. Then we'll speak about siloed and unstructured data and what challenges it poses. After that, we'll get to compliance fears and how compliance fear and hesitation delays necessary upgrades for healthcare IT systems. Then we'll get to AI implementation, and after that, we'll ask Jason a few questions about his business journey. So let's get to our first big challenge. The current state of healthcare IT is both challenging and also creating lots of opportunities and barriers. And these barriers are the areas where new products, new services, and new technologies can make biggest influence. So let's speak about the first big challenge. The first big challenge is legacy systems. Across both US and Canada, legacy systems still dominate healthcare. Many hospitals, clinics, labs, and other healthcare institutions still rely on systems that were built 10, 15, 20 years ago. These systems were designed long before cloud computing, modern security practices, and interoperability standards, and they are predominantly not ready for newer technologies integration. They have main several characteristics, which are, first of all, they are difficult to modify. They were built a long time ago, and usually the programming languages and frameworks which were used to build them, it's simply very difficult to find professionals which work with those technologies right now. Next point is they rely on outdated languages and frameworks. That's pretty much what I explained. Those languages and frameworks, they are full of hard-coded rules, which again makes it difficult for external APIs integration and generally any modern technologies implementation, because there are rules which were built many years ago. The documentation may be lacking, and people who try to make any changes, they become very cautious, and people who have those systems, again, they become very cautious and they're very scared to make any changes there. And that's why those systems usually do not support modern integrations very well. This means usually that even simple updates like adding a new feature or connecting to a different system, they can take months and cost lots of money. That obviously interferes with the modernization requirements and adopting new technologies. Apart from the fact that integrating something becomes very difficult, also it is very expensive, and organizations tend to delay such decisions and become even more technologically outdated. This basically creates a loop where you want to introduce a new technology, but you cannot do it because the system is outdated, and the longer you wait, the more the system becomes outdated and the more difficult it becomes to introduce any new technologies. When it comes specifically to AI integrations, these systems usually cannot support the data flow, the compute requirements, and generally security controls needed for AI integrations. So again, on the one hand, legacy systems make innovation very slow. On the other hand, it is a clear business opportunities for companies who are ready to do modernizations and who can help with modernizations. Healthcare organizations need help modernizing, rewriting, migrating, and rebuilding the systems safely and step by step. Companies that do modernization well, especially while respecting compliance and taking into account, they automatically become important partners. Next point is siloed and unstructured data, and Andrei, I believe you can help us with that.
Yeah, okay, let me speak about this challenge. So the second major challenge is that healthcare data is extremely fragmented. It is stored in many different systems that do not talk to each other. As for example, so it could be a lab information system are separate from EMRS. Imaging system are separate from analytics tools. Billing and scheduling system operate independently. Paper forms are still used in many clinics, and transferring data from paper into a system becomes a very tedious process and often delayed or omitted, which may result in loss of patient data. Some organizations store data locally, other in cloud. So AI, automation, and real-time decision making all depend on connected, structured data. But in reality, the data is scattered across dozens of databases, formats, and software platforms. All of this makes building modern tools very difficult. AI, as it often advertised, is not plug and play. It needs clean, well organized data pipelines. And building those pipelines requires modernization work, integration work, and strong compliance review. Healthcare providers and startups don't just want these capabilities, they need them to move forward. Okay, so let's move to the next one.
Yes, the next point is compliance fear, which is delaying necessary upgrades and which is a big factor in that. The third, compliance is still not very well elaborated from legal perspective, specifically for AI development. That's a problem that many companies were anticipated when AI hype started, and this problem wasn't actually solved. We do have already some legal base in Canada and in the US about AI implementation, but it is, again, it's not very well elaborated. It creates lots of confusion, and there is no clear solution to it right now rather than just waiting. And all of that interferes with business practices. Obviously, while integrating AI, companies need to pay attention to compliance requirements in their respective regions. In USA, we're speaking about HIPAA compliance, high-tech compliance. We're speaking about FDA guidelines. In Canada, we speak about IPEDA, IPA, for example, in Ontario, HIA in Alberta, and other provincial and health information laws. Generally, different compliance requirements in different regions create a substantial challenge in themselves, since if the company is operating in several regions and specifically in several countries, it needs to take into account all the compliant requirements of the respective regions where it operates, and combining them together and making sure you follow all the requirements becomes a very, very difficult and expensive and complicated process, and it interferes with basically creation of new businesses, and it interferes with providing patients proper services very often. The most common issues businesses have with compliance are the following. For example, migrating to the cloud breaks compliance. When you are migrating to the cloud may be located in a different region. When you are, so basically, if your compliant requirements forces you to keep patient data on site, you already cannot do it. So this is already a challenge. Next point would be rewriting a system might introduce security risks. Existing systems already have certain security risks. Rewriting them, creating new systems requires the development team to go through compliance audit, or to go through basically checking all the functionality through compliance angle. And if any issues appear, that can take them to legal action in the future, which again makes businesses hesitate about creating new opportunities. Next point would be using third-party vendors, which might violate privacy control. For example, again, you are using a piece of software from a third party, some kind of API, for example, and it uploads the data from your location to the cloud. The data, basically, your patient's data now is located in a different place. Or even if it doesn't take the data, for example, it processes the data, there can still be some leak of patient data. And the final point would be that implementing AI might expose patient data to third parties. Again, example, the nurse needs to, or for example, an admin in a hospital needs to transfer data from paper to the computer and asks ChatGPT to summarize it. When you're uploading anything to ChatGPT, OpenAI has all your information. And by the way, they're pretty much open about that. But people often don't know that, and unknowingly people break compliance requirements that way. So again, people who are working in the hospital, they must know those technical limitations. They must know those requirements, and businesses who are providing IT services to healthcare organizations must take that to account while developing the software. Generally, companies know that systems are outdated, but they don't want to accidentally create compliance programs. So problems. So often they just do nothing. They stay with the systems that are insecure, inefficient, and expensive. Either they're afraid of change, or they're not sure they're ready or capable of modernizing their systems. And what healthcare companies need to understand is that to overcome those obstacles, they do not need just developers, they need partners who understand how to modernize without breaking compliance, and who can bring compliance experts on board, and who can make the best use of modern technologies and guide them through the entire process. And now we get to AI implementation. Andrew, please help us
Yeah,
with
so
that.
let's move to the next challenge. So the first challenge, and also the biggest opportunity, is actually AI integration. AI integrations can transform the industry and it creates a lot of opportunities. So industry leaders, they are already asking for such things like AI assisted diagnostics, automatic clinical documentation, predictive models for risk and readmission, antibiotic susceptibility tools, smart scheduling and resource predictions, operational automation, analytics from imaging, lab results, EHR data, and so on. But the confusion around AI is enormous. Common questions that are being asked are the following. So, what is allowed? What about patient data? How do we keep it secure? And how to ensure we are compliant with the regulatory requirements? Is this considered as a medical device? Who is responsible if AI makes a mistake? So how much can we automate? How do we keep it fair and unbiased? Where do we even start? So all of this confusion creates a lot of hesitation. Many organizations want AI but do not know how to implement it safely. The solution here is to all these challenges is the combination of the following. It's modernization plus data structuring, strong compliance, and safe AI development. So when we put all these challenges together, legacy systems, siloed data, compliance fear, and uncertainty around AI, we can see the bigger picture. The implementation of innovation solution must not be a one-time activity, but an ongoing strategy that involves constant monitoring of industry, tech trends, and actively analyzing existing system and their vulnerabilities and flaws.
Okay, thank you, Andrew. And now let's get, I believe, to the most interesting part of our conversation today. Jason, yeah, I would like to bring in here somebody who can help us better understand the compliance journey when creating a healthcare business with a tech angle. Jason Merrick, a medical professional with lots of years of experience and also a business owner. He will help us understand real world impact of compliance challenges from patient care and for technology adoption. So, hi, Jason.
Hey,
How are you doing?
good. How are you?
We're fine. Thank you.
It was good listening to you guys. There's a lot there with AI and healthcare as far as from a development perspective. So I learned as well.
Yeah, I'm happy about that. I hope that our efforts, if our efforts help anybody to understand something about tech at least 1% more, I think we succeeded.
Yeah. Yeah.
Okay.
AI,
Uh,
I mean, it's such a nebulous thing that, it's going to be a learning process with I think, a steep curve. So, um, 1% is
yeah,
good.
lots of expectations, lots of hype, but we must keep it to the ground, keep it real, and be very reasonable about it, I would say.
Hmm.
So let me ask you a few questions. So the first one would be, can you say a few words about Assured Pediatrics, about your business? What does it do, and where did the idea come from?
Yeah. So when I gave my introduction, I also meant to say that I am a business owner, a founder, co-founder of Assure Pediatrics. We have an amazing team with strong technical and clinical backgrounds. So there's a team behind this whole company name, with a vision. And so I'll talk about that piece. When we started, Mustafa and I, it was before the pandemic, and it was based on his technical expertise and my clinical experience in the field. I really enjoy being in the field. Not to go off on a tangent, but it's a lot of my experience with pediatrics is in the field. And so both as parents, and it kind of started, I guess, as us as parents, and seeing the opportunity with a telehealth app, with the mobile smartphone, the mobile environment, to improve parents healthcare experience with pediatrics. And so he saw it from the mobile video side of things, and I saw it as from the parent healthcare side of things, both as a new parent in 2019, and then also working on EMS and what parents had encountered through my years of the ambulance. So it started off in that realm. And we have a telehealth app and an advice line is where it started. But we learned something very crucial, I think, that startups in the healthcare space that are service oriented need to learn, and that is who uses the service doesn't necessarily mean who pays for the service. And so that was a steep learning curve on our part, and we had to evolve. And during that process, the city of Phoenix, notably the Head Start, learned about our app, what we're trying to do, how we're trying to improve healthcare for parents and youth and pediatrics, and extend the access and the affordability of healthcare. And so we developed and created a partnership with them to increase preventative care and the adoption of well child visits for the Head Start population. And so now we've become a clinical and technical startup, a preventative primary care provider in Arizona, in the Phoenix metro area, which we're just getting going now. Also, a technical side where we have a virtual app that will be the basis of our further roadmap and technical footprint, is where we're headed as an organization as well. So, really combining a technical side and a clinical side, which I think a lot of organizations have talked about, but we're in the process of implementing at the same time, which has taken time to do because of the regulatory and compliance process, which I'll talk about next.
Okay, thank you. How do you assess the current state of IT in healthcare, and what are the main consequences of that state for healthcare businesses?
Oh, that's a big one. I to talk a little bit. I remember when I first had to start charting. And in healthcare, I think that term's synonymous for clinicians with healthcare is charting. And so I started with paper charting, bubble charting, carbon copies, things of that nature, and have seen the evolution to what it is today. I was very young, so everything was kind of new to me during this evolution. But I started there, and then I wasn't so in tuned with the laws that had been passed because they were probably passed before I started, but I saw the implementation of them. Um, which was a process. I was, at a hospital that was a rural hospital that was critical access, and so they got a longer period of time to adopt the EMR, EHR charting, and so I've seen a lot of that. And with the current state of IT and healthcare, I would say it depends on what side you're on. Are you in the hospital? Are you in the field? Where are you at? And that's one thing people don't know is it seems to be that there's electronic charting for every little industry that exists. And so I would say we have still a long way to go with integration. We at least have codes and languages that for everybody to talk together, but nobody's talking together. So I would say the challenge, the current state of IT healthcare is it's not happening yet as it should, and so it's not necessarily the capability to do so or the language. We have these languages called HL7, FIHR. So we have the technical capability to do so, but we haven't done it yet. So in my opinion, where we're at the state of IT healthcare, it's the implementation. How are we going to implement what we already have? Because it's not being done. There's nobody talking together, very little. Epic has been forced. I guess you say if the king of the hill is Epic in healthcare, it's the large system used by most hospital systems, them and Cerner, which is now Oracle. But they're just now being forced to integrate with other solutions. And it's definitely not happening underneath that. On top of it, I would say that, I was just reading something else a little bit there. Besides the implementation of it, it's that some of these systems are built on old legacy software. And so we're adding I work with the system, I won't name it right now, in home health, that still glitches from an old database structure. So it's built on, legacy system, and they're adding AI on top of it. It makes me worried, to say the least, because it glitches every day. And we're adding AI, and they're rolling out AI, and they're rolling out ambient listening. But what about the alarm bells? Like, hey, you never fixed the problem in the beginning. So it's like, it's like in real estate when you say, if you're going to buy a home, you want to have a solid foundation and a good roof, right? But it seems like we're building on top of a bad foundation. And I'm worried a little bit on that sense, and that we're adding all these layers and rushing to AI when we don't even have a solid foundation yet. And then lastly, I would say that, as far as adoption of IT, I think virtual appointments by and large are a hit. Being able to give people variety and choice and flexibility, and that's a key component of virtual appointments. I don't think they're being adopted completely or as well as it could be, which is one thing we're doing at Assured Pediatrics. But I think where we are struggling is in remote patient monitoring. Again, we've rushed to have solutions that we didn't really understand the need yet. I've been in home health, I've been on ambulances, and I have yet to have one patient ask me, could I get a remote O2 sensor? Could I get a remote heart rate sensor? Could I get, and then you propose it and So if you don't have a population that is clamoring for it and they're the ones using it, what kind of adoption are you going to have? And what I've seen is a unequal, jagged, imperfect adoption in the patient population, because we haven't really expressed the need to them. We've expressed the need to investors. We've expressed the need to healthcare B2B companies, but the end user, I don't think they really see a benefit yet, other than being forced to do something. So I think those are the things of IT. A lot of opportunity, still a lot ways to go in the implementation.
Yeah, it's by the way, it's such a common thing overall with AI implementation. Companies are trying to force it into their products when users are not actually asking about it, and they're trying to show it as a value when again users are not actually asking about it, and it's create first of all lots of confusion. Second, companies are proving to investors that look, we have all this cool stuff, but it does not directly bring them more money, because again users are not really asking for it, and there is no additional value often. So the value is being presented. The value is shown on the presentation to investors, but not always shown to the actual users. So that's a very common thing generally.
Yeah, and
Okay.
the other side of the coin is that their system could not be ready for the AI implementation. The data could be like in a different sources and not ready to be fed to AI models.
Yeah, exactly. Before we get to the next question to Jason, I would like to say to our viewers, please check the two links at the bottom. You can book a consultation with us, and if you have a software modernization request, or you can also book a software modernization assessment, which we provide as an additional service. So if you'd like to understand what is your current state, you can get a free assessment if you register there during this webinar. Okay, let's get to the next question. Jason, can you give a few examples of compliance challenges that you faced when you organized Assured Pediatrics, and maybe some interesting life examples how you managed to overcome them?
Yeah. I will use this example. I always like to have a mental structure of understanding a topic. So healthcare is often compared to the airline industry for two reasons. One, each industry, and you know, if you look at them too, you don't. It's hard to see similarities until you understand what the purpose of each is from a compliance standpoint. So each is obsessing about safety. Um, so healthcare and airline industry is inherent safety, patient safety and passenger safety. So that's what compares the two. And then having standard operating procedures, having things in place as much as possible to standardize things so that success is built in and processes that are successful are built into each structure. So you could think of compliance at top as, you know, in airline industry, it's passenger safety, and healthcare, it's patient safety. Do no harm, which is the big overriding kind of guiding principle in healthcare. Do no harm. So compliance is the heart is patient safety. So if you think of it that way, everything relates to that in some way or fashion. So from a clinician standpoint, from a paramedic standpoint, an EMT, I've been dealing with compliance a long time. It's getting licensed, maintaining your license, proving that there's nothing you've done to disturb or to harm a patient, and therefore have action against your license. And so there's recurring every 2 years licensing, and then if you have certificates like emergency medicine, like different special certifications based on where you work or in what field, you can maintain those as well. So I've been dealing with years from that compliance standpoint. And then now with Assured Pediatrics and having a practice, it's multiplied by like exponentially. So not only as a practice, we have to make sure each provider is maintaining their credentials, which a provider compared to a clinician has even more layers of compliance to meet, because they're ordering, they're prescribing, they're creating the healthcare plan, if you will. So we're making sure they're maintaining their compliance. And that we are meeting our compliance as well. So to answer your question, it's been a lot of not only is there a lot of challenges in compliance because you have so many layers. You have licenses, you have certificates, you have agencies, um, you have on top of that vendors to meet those compliances. So there's layers upon layers when it comes to compliance, and you eventually get to having individuals who are compliance officers and compliance specialists to maintain those. So it all started for us with this in understanding how we can actually simply um, put in a claim and order medications, right? I mean, start at the basics as a practice, and that's where my learning started in early 2024. Okay, have this great partnership with City of Phoenix. How do we see patients? How do we bill? How are we compliant? And what do we do? And so that process, there is no. I wish there was a school to understand. I'm sure if you come out as a doctor, but I've heard in talking with vendors that even doctors, MDs, NPs have a lot of trouble understanding how to start a practice as well. So I'm not too familiar with their schooling, but it sounds like everybody is kind of just thrown into the water and has to learn to swim, I guess, is the best analogy I could use. So for me, I guess the first challenge was understanding what a facility exemption or a facility license was. And that comes from the Department of Health. And they're such large organizations that they don't necessarily have the capacity to bring somebody new along. And so understanding who we needed to get help from, I think, and who we needed to hire to help us was my ground zero. So I didn't know there was healthcare consultants. I learned that's who so finding the right field in the right industry was challenge number one, because without them, we would have never been able to get a start. So being able to ask the right questions and doing my own due diligence to understand what those questions should be was start one. And I'm going to kind of go from early 2024, where that started, to now, which was the final, I guess, the period at the end of the sentence to complete our ability to act as or to be a practice, which was vaccine authority, especially important for children, is vaccines in Arizona, which is where we start, especially in central Arizona. It's the vaccine authority, which is the vaccine for children, VFC, and going through that process, which took 3 months. And it's having a vaccine management program, having a regular monitoring of the refrigeration units prior to even ordering vaccines to make sure we're meeting the right temperatures. Temperatures are huge, both where they're stored and then in how they're transported. And so I would say the vaccine program has been another area where we faced a challenge and we overcame it. Especially with our models unique, we don't go to big events. We are different in that we are mobile practice, but without having a mobile van. We use out of our car and we go to locations which can be anywhere, not anywhere. It has to be within a certain distance, but within that distance for the vaccine authority, it could be anywhere. And it's not going to just be one location, one event. It's dynamic. It's in the field. It could be at a Head Start location of 6 in the city of Phoenix. It could be at a school. So we move around a lot in that sense. So we had to create a program with the vaccine authority in a way to keep the vaccines cool during the duration and return for those ones unused. So not only are we having to meet compliance, but we are trying to innovate within this field as well. So that's another layer of complexity that had been added to us as well. So those are some recent challenges, but I would say understanding the layers and the players in each piece of compliance has been the biggest challenge.
Okay, thank you. Again, to our viewers, we'll have a short Q&A session after our interview now. So please, if you have questions to ask, please do write them in the chat. We will address them after we complete with the current module. Okay, Jason, let's get to AI adoption. Assured Pediatrics has an AI patent. Can you say a few words about that? What was the process to receive it?
Yeah, so the AI patent was something that Mustafa and I saw an opportunity for. And with our app, I would say is where we started with AI prior to the big craze in later 2022. We saw the opportunity in early 2000 or in 2019. We adopted AI in our charting in our app, where we record every conversation and then transcribe it into a chart. So we saw the opportunity with AI back then, and there was there was plugins, APIs, things of that nature to create AI. It just wasn't widely talked about. So it's been in the background. It's been implemented. And going back to 2010, I remember in 2010 when I saw my first ER doctor charting with Dragon. So it goes way back to then in actual functional use, not just in conversation, where it was being used to decrease charting time for doctors all the way back to early 2010. So it's not a new thing. It's I think it's just more applicable and more possible for a wider population now. So that I think that is kind of spurred that craze. So we saw the opportunity early on. After that, what evolved from that was infants, and both Mustafa's daughter and my daughter. My daughter has epilepsy, and his daughter has autism, and so our children were really distressed at a young age. And any parent who sees that struggles to want to help them. And my kind of assumption was her cries, and his assumption their cries weren't random, that there was a pattern, a complexity, a regularity to the sounds, that if we could figure out what each cry meant, maybe we can help that child in a time when they're stressed. And what we know today is that children who are in constant stress at a young age have toxic stress that does affect their development, and leads to other things like traumatic brain injuries from distressed parents and things of that nature. So we thought of this opportunity and then put the patent in. It was a very lengthy process. We didn't put it in internationally, and there is a couple startups internationally that have had similar thoughts, but we did for the domestic market in the U.S. And so it was a long process. It took from and we didn't have the funds to accelerate the patent. So you can accelerate it, but if you go with the standard timeline, we put it in February of 2020, and we finally had it awarded in October of 23. And we did have a back and forth with the patent office about the patent, like most patents do. But all said and done, roughly a little over 3 years to go through that process. But we did have the prior art, which is important. And the idea behind our patent is, as if you can kind of follow what I've been saying, is taking infant sounds when they're not, which is infants or early toddlers, they're not able to really express themselves, what's going on, taking the sounds, the distress, put it through it in what we call an AI engine, an algorithm that also takes into effect developmental stage, complexities from a healthcare standpoint, and then recommends to parents ways to assuage the child, to relieve the stress if possible, and if not, to talk to a provider through our advice line. So that's kind of the patent, and it's a long process. I would definitely recommend getting a good patent lawyer and doing research. The beginning of it is understanding what is out there that's already patented, doing a patent search to see if what your idea is patentable, and then going from there. So you start with hiring a researcher, and then from there you want to, if it's something that you want to pursue, you get a good patent attorney, and for us it took 3 years.
Okay, but you succeeded, so
Yeah.
it was good. Yeah. Okay, and the final question that I wanted to ask is based on your experience and your medical practice, which are the main challenges for AI adoptions in the US healthcare do you see right now?
We're part of Assure Pediatrics was part of a public policy accelerator in New York this year in August, the month of August and in September. And I'll say the same thing now that I said then, is that we're collecting a lot of meaningless data, in my opinion. I'm not a data scientist. I'm not a doctor, but I still have concerns about all the amount of data we're collecting and what, everybody's worried about privacy, but I say, what are we doing with all the amount of data that we're collecting and storing? It takes a lot of energy. It takes a lot of resources to store this data. And I think I'm not alone in saying that we are storing data that we don't even know what we want to do with. And the answer that, some would say is, well, we don't know yet what it's possible to do with that data. Well, I would say we've had a long time to understand, to possibly do something with that data. And I've seen for a long time things we're capturing from a charting standpoint that I have no idea why we're even capturing it. And some of it nobody even uses or talks about. And it's kind of pointless. Like, for example, if my heart rate is regular or irregular, I could have, it's pointless data because, and every chart I've seen has this on it, because what if I'm having PVCs, or what if I had caffeine, right? And so there's no point to regular, irregular, but that's millions upon billions of data points that we're collecting that has no relevance whatsoever. And so I would say, in my opinion, where we need to get is having relevance to the data of what we're collecting, and what I would call, contextual data or dynamic data, which is, let me explain, is data in context. So if I have a patient that had caffeine and they have a high heart rate, it takes that into consideration. But if I'm just charting the high heart rate with no context, it can mean anything, and then we call the doctor to say, hey, their heart rate's 120. Well, did they take their propanolol today? I don't know. What time did they take their propanolol? What time did they take their heart rate? And so there is a lot of data we're collecting that doesn't have context, and it's making, and I'd say this is a broader problem, and that is we're making also decisions on static data. So I think the future is simple, and that is having context to the data, because right now I think we're collecting data that has loose association at best. So to me, in my opinion, that's where we're going next, and where AI technology. And even before we get to there, I think we need to, before we add layers of AI, I don't think our system, besides Google and the big, Alphabet and the big companies, I think some of these smaller mid-tier companies are adding AI in a rush to programming, to development, to language, to code that is not able to really stand long-term to the needs of AI and data collection. So before we even get there, I think for the big players, they're just going to keep making out if the mid-tiers don't take a step back and really improve those foundations, if you will, before they get to that point. So I would think twofold. I think as a consultant or a company, helping those mid-tier companies be competitive by improving their data silos or their current programs. And then second, dynamic data. So data that has relevance, not just static, and can mean anything in the world, because we don't know what it relates to, if that makes sense. So I think that would be my answer to you, Igor, where I think the future of AI is: take a step back, and then also take a huge step forward in adding some relevance to our data.
Okay, thank you.
Yeah, thank you, Jason, for answering the question, and the information you shared with us. Very interesting and deep insights from US healthcare system. So now let's get to the questions from our viewers. We have quite a few. Let me pick some of the most relevant. Okay, so here's a good one. How do we avoid choosing the wrong AI strategy or investing in technologies that won't be useful long term? So,
Yeah, I will be answering this one. The safest approach is start with your real operational problems, not the technology. That's what we said many times, I would say, during the previous webinars. So we help organizations identify areas where AI can bring measurable value, such as reducing manual work, improving accuracy, or speeding up decision making. And we also make sure that every project is built on a flexible, modern architecture so it can evolve as regulations and technology change. So, but generally, the best thing to avoid the best thing to do in order to avoid spending unnecessary money on AI integration is identify the problem, understand what's the core of this problem, and pick the technology which fits to fix it, not reverse.
Okay, thank you. So the next one, uh, how do we stay compliant when moving data to the cloud or integrating AI?
That's a very big question, and apparently it involves compliance expert work while we are building the system. But in order to build it properly, the key is using a compliance by design approach. So this means that privacy, security, audit, login, access control are built into the system from the very beginning, not added later. We also work with HIPAA, PH, APA, and PIPEDA aligned cloud environments, and we ensure that all data flows are encrypted and fully documented. And generally, with the right architecture and safeguards, clouds and AI solution can be just as compliant and secure as all the on-premises systems, or even more secure. So the idea, again, to summarize, the idea is that apart from having expertise in compliance, we need to build architecture which already involves this compliance from the start.
Okay, thank you, Igor. So, and let's do one more. So, how do we know which process in our organization are the best candidates for AI enhancement? Yeah, good question.
Yeah, that's a good one. Well, unless you have a specific technical problem that you are want to solve, which is more or less usual case, the best thing to look at is workflows. So, like workflows, your data, your operational bottlenecks. The best use of AI cases usually involve some kind of high volume repetitive tasks, automation, or areas where staff lose time due to manual work, such as documentation, triage, scheduling, image interpretation, so on and so forth. We also evaluate whether your data is clean and accessible enough to support AI. That's exactly what Jason was speaking about. That if the data is not ready for implementation, it will just not work out most likely. So generally, the goal is to create measurable improvements, not just do some kind of AI experiments and trying some trendy stuff. Okay, and by the way, Jason, with all that said, I actually have one more question for you, which I'm personally very curious about. What do you think healthcare should not do with AI that it's doing now? Because we're all speaking about what we should do, what's good stuff, what's the proper way. So, what it should not do, what's the bad thing it's doing, and what is not a good direction that AI implementation takes in healthcare now. What do you think?
Yeah, that's a very salient question that a lot of people are asking. And some think tanks are talking about, and AI luminaries are talking about. But I'll give you my very simple answer to that question: is no AI doctors, or AI providers, whether that's NPs, PAs, MDs, or DOs. I think without question that every prescription, every healthcare diagnosis, every order should come from a human live provider. Simply put, I don't think we should. And I've heard a pitch when I was in Southern California of somebody who I they and I can't say they're right or they're wrong, but has a patent for an AI doctor. I don't know much about that claim, but I don't think that's the point. If they are correct, and it did get some investor interest, that door is being opened, right? And so we have to be very clear about and so it's the sci-fi is becoming reality. And we have to be very clear about what is our red line, what is the line in the sand. And to me, it's don't let's not beat around the bush, let's not be unclear, let's not be hazy. It's very clear: orders, prescriptions, diagnoses, care plans, those things that human providers do are not handed over to AI in the interest of whatever they claim to be. Well, we're going to make it more efficient. We don't have enough human doctors. Those are going to be your answers. We're going to make it's going to be a better solution for the patient. It's going to be safer for the patient. We don't have enough providers to all reasons to adopt that are BS. We can solve it without needing AI doctors. We should not have AI doctors, in my opinion. So I think that is that would be my answer. Not to go into more other things, I think it's very clear that that's the stopping point, in my opinion, number one.
Thank you. And I think it would be a perfect point to finish our discussion today, that no matter how technologically advanced solutions we can create, we must always retain a human component in healthcare, human trust, human professionalism. And this is something that the patients will trust probably always more than they will trust soulless technology. Let's call it that way. Generally, we see that healthcare in the US and Canada are at a turning point. The systems are old and the data is fragmented, compliance is confusing, and AI brings both opportunity and uncertainty. And these challenges can seem overwhelming, but they are also very big opportunities for organizations to modernize and innovate. And with the right partners, with the right planning, the right understanding of the problems, it's absolutely possible to move forward and to move forward safely and confidently. If you are thinking about upgrading your systems, improving compliance, or explore AI solutions, we would be happy to guide you through the process. And overall, thank you for your time today. Thank you, Jason, for joining us. And we look forward to our future webinars. Thanks, everybody. And to our viewers, last reminding, please, if you would like to contact us, there is a link below, and you will have the link in the emails. And also, you can get a free assessment of your system in terms of modernization. Okay, thank you, everybody.
Thank you. Thank you, Jason.
Thank you.